Today, we learned about some new guidelines regarding babies at risk for developing peanut allergies. It's something that impacts so many people, and here to help us better understand it is Dr. Andrew Parker with UW's Medicine Allergy Infectious Disease Unit. I appreciate you being here because I was just sharing with you, I have a husband who has a peanut allergy, and we were really careful with our kids because we were afraid to introduce peanuts to them. So tell us about this new study and what it details.
Well, the new guidelines out today are an expert review of a few studies that have come out in the past few years. One of the big ones is the LEAP study. The LEAP study found that children who are at very high risk of peanut allergy, those with severe eczema or egg allergy, can actually reduce their future risk of developing a peanut allergy by starting to eat it in their diet at a very young age.
Okay, so would that mean giving them some peanut butter, or I've always heard like the skin test, you put a little peanut butter on their skin?
That's one option. For kids that are not found to have any signs of peanut allergy to start with, yes, by incorporating small amounts in their diet, about the equivalent of 2 tablespoons of peanut butter each week, it found that over time it could reduce the risk of developing a peanut allergy.
So how does this new guideline differ from what we were doing in the past?
Well, in the past, I don't think we have as good information, but for the most part, parents may remember that pediatricians recommended against giving their kids many different allergenic foods. Peanuts are one of them, but also, things like milk and wheat. So this is a big departure, a big change from the way we used to handle allergy.
Does it come with some risks, though? Is this something that if you have a history of peanut allergies in your family, that this is something you should do and be ready to go to the doctor in case something happens? Should you be more careful?
Well, I think you should definitely talk to your primary provider or your child's pediatrician or family doctor before starting to do some of these things, especially in families who have a history of peanut allergy, or for those who have for children who have severe eczema or egg allergy.
What are some of the concerns with these types of allergies? It seems that over the years we hear a lot more about them. Are they more prevalent?
Yeah, there are some suggestions that peanut allergy has become more prevalent, up to 2% of the population the last time it was looked, so they have increased. We don't know why, though.
Mm-hmm. What are some other guidelines that people should follow as far as introducing new foods to babies that could be allergenic?
Well, these studies are particularly for kids who are at high risk of peanut allergy, like I said, the ones with severe eczema or egg allergy. For kids who don't have any sort of signs of eczema or have very mild eczema, the risk of peanut allergy is much, much lower. And so incorporating those into their diet is a reasonable option at a young age, as young as 6 months.
Do we typically know if somebody has an allergy to these things early on, or can they develop it later?
It can be developed. It can be developed later, but the most commonly allergenic foods, things like peanuts, milk, eggs, typically present when kids are pretty young.
And what is your advice for somebody if somebody does have an allergic reaction? First steps?
The first steps, if they don't have any EpiPen or treatments at home, is to call 911. That's your safest bet.
All right. Good guidelines. It's important for everybody to know. Anything else you want to add for new parents especially?
I think new parents should be hopeful about the future. Everybody should be hopeful about the future. There's a lot of research in food allergy, and I think in the future we may even have some treatment options available.
All right. Dr. Andrew Parker, appreciate your time.
Thank you very much.
Important information. Matt.
I love that optimism.